Welcome to the SABC News COVID-19 Global Wrap, where myself, Babalola Phaka, and my colleague Busisiwe Khatebe bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global stats. The world currently sits at over 36 million confirmed cases, with over 27 million recoveries and over 1 million deaths. Ranking 10th in the world, South Africa has over 680,000 confirmed cases, with over 618,000 recoveries and over 17,000 deaths.
In South Africa, concerns have been raised around the long-term effects that patients who have contracted COVID-19 could possibly experience. The term referred to as long-haul COVID-19 is when a person contracts the virus and then in essence recovers or appears to recover, but its effects remain. Ear, nose and throat specialist Dr. Rory Atwood from the Tygerberg Hospital in the Western Cape, who was diagnosed with COVID-19 this year and has since recovered, says he is suffering from such long-term effects.
10 days into the infection, I developed pneumonia and encephalitis, and that I recovered from that. But now there are lots of symptoms: sleep disturbance, swallowing and speaking difficulty. I've had hearing loss. I have tinnitus, which is ringing of the ears, both of them. My balance has been affected. Sometimes I struggle to find words. I will have to circumlocute. I will talk around something to describe what I'm trying to think of. I struggle to multitask. And I'm easily exhausted. And that's not just physical exhaustion, it's also mental and emotional exhaustion.
Also in South Africa, distance educator Brainline says the rise of e-learning over the last few months might just be the answer to the country's shortage of public schools. According to Brainline, most schools and learners had been unprepared for the move to digital platforms. Brainline Chief Executive Officer Colleen Cronje says the education experience under COVID-19 has highlighted the importance of e-learning for the future. On to the rest of Africa. The continent has now recorded over 1.5 million confirmed COVID-19 cases, with over 1.2 million recoveries, with the death toll at 37,452. Ghana's Health Minister Kwaku Agyeman-Manu says it is still too early to ascertain the full impact of COVID-19 on Africa. Meanwhile, the COVID-19 crisis is expected to drive a 3.3% contraction in sub-Saharan African economies and could push 40 million Africans into extreme poverty, the World Bank said on Thursday. And lastly, Tunisia is expected to announce a curfew in the capital after the governors of 4 provinces that make up Greater Tunis called for action to halt a surge in infections.
And in international news, United States President Donald Trump referred to catching COVID-19 as a gift from God that exposed him to experimental treatments that he vowed to make free to all Americans. Trump returned to his office at the White House on Wednesday after his doctor said that he was showing no COVID-19 symptoms, adding that his physical exam and vital signs were stable and within a normal range.
For me, I walked in, I didn't feel good. A short 24 hours later, I was feeling great. I wanted to get out of the hospital. And that's what I want for everybody. I want everybody to be given the same treatment as your president, because I feel great. I feel like perfect. So I think this was a blessing from God that I caught it. This was a blessing in disguise.
And in Latin America, Brazil has now surpassed the 5 million infection mark and is fast approaching 150,000 deaths. An epidemiologist at the Federal University of Rio de Janeiro, Roberto Madrano, warned of a second wave, fearing that more people could become infected as authorities ease social distancing measures despite the high number of confirmed cases. In Asia, India, which is the world's second worst hit region, recorded over 69,000 new confirmed COVID-19 cases on Thursday, while Indonesia reported a new record high of 4,850 cases on Thursday. And in Europe, Ireland's Prime Minister Michael Martin rejected a recommendation by health advisors to shut down the economy back into a level 5 lockdown, and opted to tighten COVID-19 measures instead as cases in the country show a rapid surge. And finally, Without much elaboration, the World Health Organization this week said that a COVID-19 vaccine may be ready by the end of 2020. The global health body called for solidarity and political commitment by all leaders to ensure equal distribution of vaccines when they become available.
For the latest updates on the coronavirus, visit sabcnews.com.